Welcome back to Dr. Duncan and Network Television Network. This is your host, Dr. Duncan. I would like to show you today share about the lower back normal, close to normal x-rays because that's important. I have had a lot of people that have talked to me about their relatives that have had surgeries for the lower back. And I know sometimes that is necessary because it depends on what's going on. But what I'm going to want to do today is to give you an understanding of when we talk about x-rays, what is really close to normal x-rays as far as looking at your spine. Because that can determine whether you're going to have surgery or whether you're going to have epidural shots or whether you're going to have chiropractic care or you're going to have physical therapy. And all these modalities are very important because they help your body, or you might either depend on medication. So all these things, we all work together as a team. But I think the key number one thing that everybody needs is education. Get to educate yourself to know what are the options, because understanding your options will really give you a better health, and that's why it's so important. And so in this area, I'm going to want to show you very important thing here when it comes to lower back, because a lot of people don't understand. Your spine is kind of like a screw, or it's things has to get together. Basically, what I mean by that, there are things have to fit where they belong. And what I mean by that is, if you look at this, is what we call a spinal process. These are the spinal processes, and what this is basically, we can call them like the tail of the vertebra. And what is a vertebra? This is a whole vertebra. This is another whole vertebra, another whole vertebra. And so a whole vertebra has what we call spinal process, and there is what we call a disc. This is called a disc. And then there are other little joints, actually very, very important, the little joints called facets. And those facet joints are these little joints that are in the back. There's one right in there, and there's another one right in there. And so those facet joints are supposed to fit together, meaning that they are supposed to, the one below, vertebra below, and the vertebra above, they are supposed to fit together. And when they fit together, they create an ability for the structure and for the entire individual to form a healthy spine. What happens, and what we see most of the time, if those bones, the one below and the one above, they are not fitted well, then we describe that as misalignment, meaning that the vertebra are shifted from the normal place and it has become misaligned. When that misalignment takes place, as I said before, then we develop what we call bulging disc, which can lead to herniated disc, which can lead to protrusion, actually entering into what we call sequestered disc. And so those are progression. And even as it progresses from bulging to herniation to sequestered, there's another thing that goes on with that. And what goes on actually, the disc starts to degenerate, or we describe it as arthritis for that matter. And so if we can keep your spine, and we can keep your joints and your spine as close to normal as possible, you can definitely be assured that you're not going to be a candidate of surgery, a candidate of long-term medications, a candidate of all the other things that might have long-term consequences. And that's why we want to make sure you are educated about what is normal x-ray look like. And so, having that understanding, you can see at this level, those little spinal processes are following one another. And so, if I was to draw a line alongside these normal spinal processes, that line will pass in the middle of those spinal processes, meaning that your spine is in alignment. And so, in this case, I'm going to want to demonstrate to you and show to you an x-ray of very close to normal x-rays, whereby, as I have indicated, these little guys here, you can see these brighter spots in the middle there represent those little spinal processes. And when you look at this x-ray, you can see it looks very close to normal. I'm not going to call it like pure normal, but it looks very close to normal. Because even if I use my little ruler here and I put it across alongside this line, you can see that line almost divides the spine into a half. Basically meaning it's passing in between the little spinous processes are in alignment, and that's what we want to see when we're looking at the x-rays. At this time, if somebody has an x-ray like this, somebody might have some other issues. Might be they have pain and muscle spasm, but in this situation their issues are not complicated. That means it's very easy. They need less treatment than people who have other issues, as we're gonna show in the next show. And so my goal today is just to show you how a normal, close to a normal x-rays look, as far as looking at the spine and see whether there are joints that are out of place or the joints are in place or good stuff like that. Given that understanding, I want to make sure you understand that if you are in pain, you need to come and see us, because we can find out what's your reason of pain. And if you have issues that are going on that we cannot be able to see in the x-ray, I want to tell you that we work with everybody. We work with the radiologists, and so we work with centers of MRIs to make sure that in case, for whatever reason, we can't find what's wrong with your spine or what's the cause of the pain, we will make sure that we send you to have an MRI, which is very important. And that's another issue, and that's another thing we'll be talking about in future. But I want to make sure you understand that when you come to us, we are there for you. We are not there to bring our ego. No, you become the center of everything. And if you need to go and see, send you to see a neurologist or a spine specialist because we can't help you chiropractically or go for physical therapy, we'll make sure we lead you through the way until you get better. And once again, this is your host, Dr. Duncan, with Dr. Duncan Show. And I want to make sure that you're going to call us when you have time. And if you have time, give us a call. If you know your relative is sick and he is having pain in the lower back and they don't know what answers are giving or they don't know what to do, I want you to call us. Our number is 248-398-1650. And once again, this is Dr. Duncan with Dr. Duncan Show. And this is going to be wonderful. The next section is going to be wonderful. I want you to pay attention because it's going to be talking about abnormal x-rays. And you're going to be able to see the difference between normal and abnormal, so that when you have been told you have issues going on with your lower back, you can tell basically this is close to normal, this is close to abnormal. And so that's going to be my next show. And I'll be seeing you in a few minutes. Once again, Dr. Duncan with Dr. Duncan Show.